Duvelisib is a PI3 kinase inhibitor. It's both a delta and gamma isoform-specific inhibitors. This is an important distinction from Idelalisib, which is a pure delta inhibitor. In this instance, we think that that inhibiting the gamma isoform is important as it gets to the microenvironment and perhaps also improving the efficacy by targeting the microenvironment, not just with the delta isoform. So there's a phase 1 trial that was conducted with Duvelisib, and in that study where we analyzed the patients who were treated with low-grade lymphoma, there was a greater than 70% overall response rate, and importantly, nearly a third of these patients had a complete remission rate with single-agent Duvelisib in this frontline, in this phase 1 trial, which was really quite important. The Dynamo trial is a single-arm study looking at Duvelisib as a single agent in patients with double refractory low-grade and follicular lymphoma. So in this instance, by double refractory, I mean those patients that are refractory both to rituximab as well as to chemotherapy, such as an alkylating agent. This study has fully accrued, and we expect to see the results soon in terms of its efficacy and overall response rate, complete remission rate, as well as a full understanding of the toxicity profile. There's also a trial known as the Dynamo R trial, and this is a study that is looking at rituximab compared with Duvelisib versus rituximab alone in patients with low-grade lymphoma. And this study is, it'll be a little longer before we know the results of that study. Duvelisib is being studied widely in low-grade lymphoma as well as in chronic lymphocytic leukemia. There are studies looking at Duvelisib in combination with rituximab versus standard chemotherapy such as R-CHOP or against bendamustine and rituximab. There are studies, I think some really interesting trials looking at Duvelisib in combination with venetoclax. Of course, venetoclax is a BCL2 inhibitor, and in this instance, we're looking at trying to treat the lymphoma with inhibiting two different pathways. So I think there's going to be some very exciting results coming out of that, perhaps at EHA this year, looking at that combination. And finally, there's a study looking at Duvelisib in combination with either obinutuzumab or Rituxan in frontline therapy. And we really look forward to seeing the results of this, at least the initial safety cohort of patients on this trial. One of the problems that has been seen with other PI3 kinase inhibitors is that they're very difficult to use as frontline therapy because of some of the problems with hepatotoxicity. For instance, Idelalisib, there was some concern about using it as a frontline therapy in patients with low-grade lymphoma. It's going to be interesting to see whether that's true, holds true with Duvelisib when it's using as a frontline therapy, or perhaps by also inhibiting the gamma isoform, whether that makes it easier to use as a frontline therapy. There are many promising therapies that are currently under development for patients with relapsed and refractory low-grade lymphoma. I think most prominently, I think about the so-called R-squared regimen. R-squared is the combination of lenalidomide and rituximab for patients, not only for the relapsed and refractory, but for also frontline therapy. But it has high overall response rates in both settings, both in the relapse and refractory setting. And so this is this is a regimen that I think has great promise for that setting. Now, there are a variety of other therapies that are also being developed. We know that venetoclax, which is approved for the treatment of patients with chronic lymphocytic leukemia, it's also been tested in patients with follicular lymphoma. And there are studies, both single-agent studies in combination with rituximab, that have been conducted and are being conducted in that setting. It makes a lot of sense. We know that in low-grade lymphoma, one of the major issues, just like in chronic lymphocytic leukemia, is the failure of these cells to undergo apoptosis. By removing the blockade for apoptosis with venetoclax, we hope that there's an increased efficacy and probably best suited in combination for that. I think there's also a number of other drugs that are further back in the developmental pipeline. Some of the immunotherapies are exciting in this arena, from the bispecific antibodies to checkpoint inhibitors. I think there's a lot that'll be coming down the pike soon.